So case one, very quickly. So we have 5 minutes. 5 minutes. 55-year-old lady, known diagnosis of cerebellar ataxia, referred to memory service due to worsening cognition. And she didn't have any psychiatric history. So I initially assessed her in 2018 due to similar memory problems. We did the ACE, Edinburgh's cognitive examination, and she scored 77 out of 100. And for those who are not familiar with this test, with the ACE, any score above 88 is normal. Scores between 82 to 87 or 81 to 87 will be mild cognitive impairment. Scores below 72 will be highly suggestive of dementia. Okay, so she scored 77 out of 100 with significant impairment in fluency and memory. And my impression was at that time that she was most likely presenting with mild cognitive impairment because, you know, she was living independently in the community. She didn't need any package of care. Her mother was helping her with some aspects, but there was no significant impairment. And I also noted that she had a brain scan in 2014 and 2018, and both were really showing non-progressive changes. So there was cerebellar atrophy, which is really seen in cases of cerebellar ataxia, but there was also generalized cerebral atrophy, but these changes were stable over a 4-year period. So if you are dealing with a condition like dementia, you would expect that these changes will be progressive. Okay, so at that time, we didn't feel that there was a progressive, a condition such as dementia. And we discharged her with a diagnosis of mild cognitive impairment in 2018. In 2020, just a couple of months ago, the GP referred her back to us. There has been significant decline over the last 2 years in all of her cognitive abilities. So short-term memory definitely got worse, speech got worse, and she now needed a package of care in place because her mobility also got worse over this last 2 years period. She had frequent falls, frequent head injuries, and still she is not presenting with any psychiatric symptoms. She was wheelchair bound at this time when I saw her in 2020 because of this significant decline in mobility, which we see in her existing condition, the cerebellar ataxia. Now the ACE has dropped by 15 points from 2018 to 62 out of 100, with significant impairment, again, in memory, fluency, but also in language and visuospatial abilities. So even her ability to repeat words or draw a cube or a clock significantly deteriorated compared to 2018. Okay, so at this point in time, what other tests would you like to do? So lady, cerebellar ataxia, 55 years old, significant global cognitive decline. MRI in 2018, cerebral atrophy and cerebellar atrophy. What else would you like to do? I should also mention that she had genetic testing to exclude any genetic cause of early dementia, and all of these tests were negative, including C9orf72. But this genetic test is very important when you are suspecting early onset dementia. Okay, so the main question I was faced with is this decline consistent with cerebellar ataxia, which is characterized, as I said, by cerebellar dysfunction and cerebral atrophy, or is there a second condition on top of the existing cerebellar ataxia? So are we dealing now with early onset dementia on top of the cerebellar ataxia? So she is under Edinburgh's hospital and they have requested the brain scan, but we don't have the results yet. She didn't do it. Can I just ask, can someone tell me the functions of the cerebellum? Because if we understand the functions of the cerebellum, we will be able to understand her presentation. So what does the cerebellum do? Is it only for more kind of coordination of movement, or is it something else? Does it have any role with the speech, the cerebellum? Because as I said, this may explain the decline in her ACE scoring. What do people with cerebellar disorders present with in terms of their speech?
It's like a dysarthria or staccato speech.
Absolutely. So the decline in her existing condition caused her to not perform very well on the speech domains in the ACE, because in the ACE you are asking the patient to repeat words and repeat phrases like, all that glitters is not gold. And all of these functions will be impaired in patient with cerebellar disorder because of the dysarthria. Okay, so the articulation of the speech is all over the place. And she is losing points because of the cerebellar condition. What about the visual spatial decline we've seen? Is that also consistent with cerebellar disorder? Now, clock drawing test. Would someone with advanced cerebellar disorder be able to do a neat and nice clock drawing in the ACE?
They might have symptoms of nystagmus, so that might affect their ability to kind of draw.
Absolutely. So really, she lost all these points, 15 points on the ACE in a space of 2 years, not because she is now developing dementia, but her cerebellar condition is getting worse. So following discussions with the neurologist, they did say that this is unlikely to be a second diagnosis. She is presenting with the later manifestation of cerebellar ataxia. Okay? So we discharged her with this diagnosis that, we don't feel this is dementia. We don't feel there is any benefit of trying memory medication in this lady. However, these are the later manifestation of her existing condition. But as I said, it just highlights the importance of us thinking about the existing neurological condition and the manifestation of that condition on the patient's cognition.